I am Angela Cunningham. I am a journalist and reporter for WZZM 13 On Your Side. I've had the privilege of having a long time working relationship with the American Heart Association, and I'm honored to be your MC this afternoon. Now, the use of e-cigarettes, or what many people call vaping, has become an epidemic among our youth. In the last year, we've seen a 78% increase in the number of high school students who are vaping. That is 1 in 3 teens that are now vaping, and half of those would like to quit. Now, today we will look at e-cigarette use, what they are, what the dangers are to our children, and what we can do about it. I'm joined today with experts on this topic. Dr. Brandon Hooks is a physician with Ascension Medical Group. Dr. Hooks is board certified in critical care, pulmonary medicine, and internal medicine. He provides pulmonary and critical care to adults. Bridget Mellon is the government relations director in Michigan for the American Heart Association. She's also a registered nurse. And Margot Trammell is the youth market director for the American Heart Association. Margot is also the mother of 2 girls. She and her husband are trying to raise in spite of COVID and vaping environments. Now, before we get started, I would like to give a special thanks to our sponsor, Ascension Borgess, for sponsoring this very important webinar today. Now, Dr. Hooks, we're going to kick things off with you. I know you have a presentation. We all saw that you were preparing that for us about the consequences of e-cigarette use, a bit about the devices, and even some information about the impact of COVID-19 among those that vape. Welcome, and I'm going to turn it over to you.
Thank you so much. I first want to extend my appreciation to the American Heart Association for this opportunity, and I want to thank those that are joining us live today for this discussion. It's a great pleasure to be partnering with an organization that is really taking charge and lead with vaping and really starting with the core, our youth and adolescent, so that it really alters behaviors that hopefully don't turn into long-term consequence. I'm Dr. Hooks. I'm a pulmonologist and critical care physician at Borgess. I don't have any disclosures or conflict of interest for this talk. Here's my roadmap of what I would like to discuss with everybody today, briefly providing an overview about electronic cigarette use. What are the science behind it, the modes of delivery, the harms, and with the current state that we are having, COVID, any sort of relation that we have between vaping and the predisposition to actually developing COVID or being more susceptible to COVID. So let's talk about vaping as far as a historical timeline. Vaping was introduced into the marketplace starting in 2007. For me, we almost think of it as it starting much earlier, but believe it or not, it was 2007. It started to be entering into the market as a alternative to tobacco use by cigarettes. It wasn't until 2012 we started noticing a negative impact of vaping and vape use with lung health that prompted case reports of those who had used vape, development of these atypical presentations of lung injury. In 2014, shortly after that, the marketing, the accessibility of this vape became very apparent, and it was the most common used product amongst our youth. And in 2018, this number was alarming. This is 3+6 million people, a large majority of our youth reported in the last 30 days that they had used vape. When you think about that, as far as our geographic and population, 1 in 5 high school students were vaping, and now even 1 in 20 middle school vape. So it is becoming more prevalent. and the use is becoming more widespread. It wasn't until recent, in 2019, we noticed this to become an epidemic, and that was declared by the Centers for Disease Control. And it was an alarming sound of pause and evaluation to why is this happening? And that prompted definitions to be created for electronic associated or vape associated lung injury. Now in 2020, our current state, we've had multiple admissions that we've been able to acknowledge since then, and 60 reported deaths. Now that data is from February of this year, so 60 deaths as of February. What is the science behind it? Why is it with vaping? Vape itself is a mixture, and I think part of the tool with vape itself is marketing. It's marketed as juice or e-liquid. It's an aerosol of a mixture, and that mixture contains multiple things, and it uses carrier molecules that deliver a substance, and this could be either nicotine, THC. The majority of it is a propylene glycol and or vegetable glycerin solution, and they add a flavorant to it, which until recently was banned. Now these chemicals, what they do is when they are inhaled, they induce an immediate inflammation and breakdown of the lung tissue, causes a really significant lung injury from the inhalation of the smoke. It's an irritant. It's an irritant in the airway. In addition to this, which is scary, is it also contains formaldehyde. So when these chemicals get heated up, the byproduct is formaldehyde, which we know is a cancer-causing agent. And that is from the heating of the propylene glycol in the vape pens. To look at a diagram and to appreciate this more, let's talk through this, okay? The vape pens have the aerosol, and I mentioned the chemicals that are in it. Some chemicals that are also seen as part of a cause of vaping associated injury was vitamin E, but we don't also realize that when we're inhaling the vapor, not only are we inhaling the vapor, we are also inhaling the heavy metal. For that vape substance to be changed from a liquid to a vapor, it has to generate enough heat greater than 400 degrees Fahrenheit to change that liquid to a vape. In the process, what it's doing is that coil is heating up, and that coil is metal. The heating and rise in the temperature of the metal will release the metals itself. So not only are they inhaling these chemicals and carcinogens, they're inhaling heavy metals such as manganese and zinc. What happens is you start getting airway inflammation. The airways become resistant and they could be hyperactive, causing people to cough. And when it is going through in the lungs, it's causing irritation of the cells that protect the lungs and worked as a defense mechanism to fight infection and clear mucus. The tiny airways, which we call the alveoli, they are like the tiny balloons that open and close. When you inhale the vape, it is easily able to be penetrated throughout the entire lung tissue down to the small segments of the alveoli, which are very important for the exchange of oxygen from what we breathe to the body. And that itself will disrupt the protective covering of these cells. I'm going to talk further in my slide about the long-term effects of that as consequences of continued use. But I wanted to take a moment of pause and speak a little bit about our current state of COVID-19 and the pandemic. Right now, I'll be honest with you, As a specialist and a physician, the evidence that we have with COVID and vaping is limited, but science is actually looking into this further. What we do know is when people are smoking, they represent this vulnerable population that is more likely to develop severe disease. And it could even be potentially life-threatening if they have an underlying respiratory disorder. We know that smoking itself impairs the immune defenses and limits the body's ability to fight or ward off infection. Not only does it limit our ability to fight infection, the vaping itself reduces our lung function. So if we were to get COVID and we have reduced or impaired lung function, the severity of it, as you can imagine, would be worse than a normal individual. Let's talk a little bit about the vaping devices. Now, vaping devices come in many different forms. They are marketed in a way that's attractive. They are easy to conceal. The other thing that's hard for parents is it's hard for us to even identify if somebody's vaping or not. So they're not only able to conceal the device, they're able to conceal it as a addictive behavior, because the vape itself doesn't emit any sort of odor. It's an odorless vape. Whereas if a teen or adolescent was smoking cigarettes per se, that would be something that we're able to smell the residue on clothing. But vape doesn't have that. Now, let's talk about this as the anatomy perspective, what I like to say of the vape pens itself. The pens have a chamber, and you could put in there, THC, you could put nicotine. They have an atomizer, which is the heating coil that is used to get high temperature to generate the liquid into a vapor. And at the very end, it's a battery powered unit. These get very hot. And we all have stories that we've heard of these devices exploding. And they do that because the heat that's generated just to even make a vape is so hot, so intense that it can combust. Other vaping devices are such as what's seen here. They had Juul. I remember going to the convenience store, the gas station, and these would be placed in a very accessible location within, which in the store is right at the front. It's convenient, it's accessible, it's easy to conceal. You could put it in your pocket. It looks really like a USB cord if you were doing a project. And then this here is something that's called a dab device. Let me help you understand this. A dab device is actually used when you take a substance. It's a wax. They call it a wax. And the wax is actually scraped out by that dab tool. So you actually have to take the wax and you have to put the wax actually in that atomizer. And you could see over those coils that are wrapped around like a spiral on the cylinder, that itself will melt the wax. And when it melts, you are inhaling the byproduct, which if you think about it in those terms, it's scary. You're taking a wax and then you're burning it and inhaling into your lungs. But this is something that's used amongst our teens. It's more used when they're vaping THC containing products. What is vaping associated lung injury? We've had many terminologies that have come from this, and we have specific guidelines, both set by the CDC and the World Health Organization. We've termed it vaping associated or electronic vape associated lung injury. But let's talk about what happens. The anatomy of the lung, I put in two diagrams for us to see. And let's break this down a little bit. We know when we start the vape, we inhale it through our mouth, it goes down through the level of the vocal cords, down into the lungs. Once it reaches inside the lungs, it's conducted through the airway. And if you look onto the right, you see what looks like a grape stalk or grapes on a branch. There's blood supply that is actually going to those regions, and those tiny little circular structures are the alveoli. Those are crucial for the exchange of oxygen into the bloodstream and the elimination of byproducts, carbon dioxide, what we blow off. The vape is such a very dense material that we breathe. It is easily able to go down into the tiny, small conducting airways. And so it really migrates to those areas, and it causes a lot of inflammation at that region. And that's not a good region to actually have a significant amount of inflammation in, because those are the structures that are so integral with maintaining our lung function. What are the adverse side effects? And we know there's many, not only with vaping, but with nicotine. We have nicotine poisoning. Nicotine itself, when they're getting the vape products, they're able to get it at a specific concentration. Let me tell you a story and just take a moment of pause to share this with you. 1 week ago, in my office, I had saw a 18-year-old who was coming to me because they vaped and they were having significant amount of breathing difficulty. When I probed a little bit more, I learned that they were vaping 50% nicotine, which was a very high concentration of nicotine. She didn't realize it, but if she continued to vape, she could have nicotine poisoning from it. And she actually unknowingly had some of the symptoms of that without even knowing it was related to the vape and the concentration of vape that she was vaping. The devices itself can explode. It could cause injury not only to the GI tract, respiratory, and cardiovascular system. They work very hand in hand. Now, we talked about the vapor itself, but what happens is I've seen, and I've actually had to do a procedure where I've taken a scope, it's called a bronchoscopy, and looked in someone's airway who did vape. And I could tell you that the airway is very friable. Any gentle manipulation of the airway or coughing, blood vessels break, the lungs look angry. Aside from this, the longer duration of use that you have, the more frequent that you use it, this can lead to long-term consequences of chronic lung disease. These include asthma attacks. Say if people vape and they have underlying asthma, it is going to get worse. In some situations, I've had people vape so much that they've caused a lung to collapse. In a very worst case scenario, we have what's called irreversible lung damage. We have interstitial lung disease, that's the cells and the portions that protect the lung and cover the lung develop scar. The lung starts laying down scarred tissue. And I was actually one to report a case that I had that was evaluated by the CDC prior to the release of their declaration for an epidemic that was confirmed. She is a patient of mine who was in her 50s that was vaping as an alternative to quit smoking, who actually had proven irreversible lung damage and scarring as a consequence of vaping. So it is out there, it is getting more prevalent, and we are seeing it more commonly. This is a pictorial or an image of what it would actually look like. And I've seen these in my own practice of pulmonary medicine, patients that have had that. The one that I just talked about and used as an example had all these features. But it really causes a lot of inflammation in the lung. And sometimes people require oxygen, even during these acute periods of exacerbations. And in some circumstance, it's not reversible. What are the symptoms and how might you know somebody is actually experiencing some of the symptoms of vaping? Most commonly, we have shortness of breath as indicators of it being a consequence of starting to show lung-related problems due to vaping. Sometimes oxygen levels within the blood can be low. They could be coughing up phlegm because the lungs are very irritated, trying to clear and bring up mucus. And sometimes you might notice this too with a change if they're vaping more, vaping less, they're using a different substance to be more prevalent. Additional symptoms that we will have is coughing up blood, and I've seen this as well. People will cough up blood because the airways are so irritated. It's like if you break a blood vessel. We've had circumstances before, if you cough very hard, blood vessels break in the face. That also happens within the lungs. Chest pain can develop. You could develop what's associated with this vaping is almost an immune response. People get overwhelming fever, sweating from vaping and vaping in excess. So what do we have that actually treats the therapy and helps eliminate this? What I could tell you is probably the most important thing we can know today is stopping the use of electronic cigarettes is our highest and most prevalent priority. We need to focus a lot on prevention. And I think the American Heart Association is really taking this initiative and trying to educate our public, our youth, and those that vape. Not only educate them, but actually provide them with resources. Very rare circumstances with vaping, people need to be hospitalized. They need to be put on a ventilator. And some even need what's called a heart-lung machine because their lungs are so overwhelmed by the inflammation that they cannot take up the oxygen we are providing, even at the highest level possible. The lungs themselves do not work. And simply, sometimes the recovery from this can take months, weeks, and it may perhaps be irreversible, which I have seen in some of my patients. How does this hit home? And how does this really resonate with the mission of the American Heart Association? I think it's really explained here. Henry Ford Hospital, which is a hospital in Detroit, actually had a patient who was 17 years old, was a student athlete, in fact, who had a great future ahead of them, football star, exceptional athlete and student who just picked up vaping as his friends were doing. And he realized that he was getting addicted to it. And he started vaping more and more and more over the summer until he started having some issues with his breathing. What happened was he developed significant lung injury that he was hospitalized and he had to be on that heart-lung machine. Well, they realized, soon after, they would not be able to reverse this. They would not be able to treat him without doing a heart-lung bypass. And Henry Ford Hospital actually did just this. They did a double lung transplant. They were the first in the nation to do this. But this speaks volumes of what started in 2007 as an alternative to reduce cigarette use turned into a double evil of causing more harm than it ever was intended to. So this hits home. This is a reason why we educate, we prevent, and we have a conversation with those that are vaping about harms. That is my talk. I've left here some summaries to share simply this: it's a global health concern. Data is ongoing. It's being collected. Our treatment options that we have right now really are limited. Prevention is the number one thing that we could possibly do so that our youth and even young adults do not have chronic lung disease and have a very promising future ahead of them. Have a conversation with your youth, even if you suspect or don't suspect that they are vaping, about the harms, consequences, and see it as a way to communicate with them without punitive action, but as a resource to help them with eliminating this from their behavior. It was such an opportunity today to share with you this topic. I thank you so much for the invite, your attention throughout the presentation, and I look forward to answering questions at the session at the end. I'm going to stop sharing my screen and turn this back over to our moderator.
Dr. Hooks, thank you for that incredibly important and, quite frankly, frightening information. I know it really highlights and underscores the state of this crisis that our kids are facing. I know it also has evoked a lot of questions in me and others, and we will have a Q&A portion later in this program. However, I do want to ask a couple of questions right now. I know Bridget had one that I think is really important to ask. You mentioned people using vaping initially as a way to stop smoking. What do you say to people who still use that argument for vaping?
Very good question. And I think what I could share with you is we have these societies. I'm a part of a society that I'm connected with from my pulmonary and critical care specialty. It's the American College of Chest Physicians, who initially they had a statement in 2007 after the vape product was used as supporting it. Actually, so we in fact did a little bit harm. We jumped to conclusions before we had any evidence or science about the product itself, and I felt that it sort of misled the the community, misled people to believe that it was safe. Now we know that's not the case, but trying to undo that is something that I do often in my practice with patients. Is first taking a moment to actually educate them about harms, educating them about the vape itself. What does it do to the lungs? How is it different than smoking cigarettes? And the most interesting thing about this, and I'm glad that you mentioned this out, is, the two with stopping smoking cigarettes and vaping, a lot of people have this misconception, even to this day, that vaping is not smoking. They don't see it as such. They think of it as something different. It's less risk of smoking. So that's the thing too, is, talking, even though you're not smoking cigarettes, you are still smoking. You are still vaping. Vaping is smoke. It's just a different delivery of it. So I spend a lot of education on that as well.
Thank you again. We value your time and your expertise on this matter. And again, as I mentioned, we will have a Q&A portion later in this program. If you have any questions, this is a perfect opportunity, and throughout the rest of the program, to type those questions in chat and we will get to them. I mentioned Bridget Mellon again is the Government Relations Director. Bridget, I want to ask Michigan Government Relations, Director. I want to ask you, tell me right now what the American Heart Association is doing on a policy platform to really address this issue.
Hi, good afternoon. Thank you. Well, the number of adolescents and youth using new forms of tobacco, such as e-cigarettes and vaping, has skyrocketed, and that's placing decades of progress at risk. Flavors they play a major role in youth initiation and continued use of e-cigarettes. So one of the things that we're working on to truly protect our youth from addiction is that we're advocating that proposed rules from the Michigan Department of Health and Human Services prohibits the sale of all flavored tobacco products and all flavored vaping products in the state of Michigan. That's really important and something that we're really passionate about. You know, we know that certain strategies work well. In December of 2019, the federal government passed the law raising the minimum age to purchase tobacco products to 21. And that's a good step. We know that 90% of smokers become addicted before the age of 21. So taking action to make it more difficult to try these devices is a good step. Also, again, focusing on the banning of flavors. There are, I think, approximately 15,000 different flavors on the market. It's hard to even keep track of them. But many of them are candy flavored. We've got cotton candy, Skittles, bubblegum. These are appealing to our youth. Another thing that we can do is to tax e-cigarettes like we do traditional cigarettes, and to increase that tax and make them the same across the board, so it doesn't make one product cheaper than the other. Also, funding tobacco prevention and cessation, and providing better cessation offerings to our teens is an important piece that we advocate for. And then finally, enhanced penalties for the business owners, the retailers who are selling these products to our youth.
Thank you. Sadly, we know that a lot of young people are introduced to tobacco products at school or in school environments. Tell me a little bit about what you guys are doing with the Tobacco Free Schools initiative.
Well, this is really exciting news. Recently, the CVS Health Foundation provided a grant to the American Heart Association and the Alliance for a Healthier Generation to launch the Tobacco Free Schools initiative. And this initiative provides anti-vaping and cessation resources and a new tobacco-free district model policy at no cost to school systems to ensure that administrators, teachers, and students have the support that they need. So it's really an important initiative because schools are on the front lines of the e-cigarette epidemic. They're uniquely positioned to identify and support students that may be addicted to nicotine or at risk of addiction.
That's a great point. What should schools be doing, however, when they catch students either smoking or vaping?
Well, this is a really important question. According to the Centers for Disease Control and Prevention, the most effective approach to help students quit tobacco use is really through counseling and education. Studies show that the use of suspension, it increases the likelihood of negative educational outcomes, including lower test scores, lower graduation rates, and reduces the likelihood of enrolling in post-secondary education as well. It's also important to know that current evidence shows that punitive measurements like suspension, they do very little to curb the use of tobacco products. And they also disproportionately impact students of color. So rather than punitive discipline, the American Heart Association supports programs that really focus on recovery from and reduction of nicotine addiction.
Thank you, Bridget. Margot, let me turn it over to you. For you guys in the audience, let me reintroduce Margot. She is the Youth Market Director in Southwest Michigan. Margot, you're working closely with these kids that we're talking about. Tell us a little bit about your work in the schools.
Okay. Hi, everybody. Thanks for having me. We have youth market directors across the state of Michigan, and we're actively working in the schools across the state. Our Kids Heart Challenge program has been in schools for over 40 years, and we're leveraging those relationships to introduce educational materials directly to students and teachers, administrators, and parents. We have free lesson plans and resources both in English and Spanish that it focuses on the vaping along with other heart healthy habits. I do assemblies as well as my colleagues for middle school and high school students as well.
Thank you. Tell me a little bit about your conversations with the teachers and the staff as far as them encountering students that are smoking or vaping.
Yeah, if we could show a slide, I will show you a slide that kind of depicts some of the products that we're seeing. Okay, so as you can see, it's not large, but you can see in the picture on the left, these are the different devices. We have smokeless tobacco, nicotine patches, so similar to breath mints. We have cigarillos, which have fruity packaging that looks kind of like a fruit roll up or some type of fruit strip. Just as Dr. Hooks has said, we have the Juul, which looks like a flash drive. One of those pods has more than, is like smoking 20 cigarettes worth of nicotine. We have vape pens. We have vape hoodies. You can see for the student that has it looks like an asthma inhaler, a rescue inhaler is actually something kids can purchase. So not all the products look like traditional e-cigarettes and cigarettes. I've been in schools that have shown me the vaping devices that they have confiscated, and it will be a huge box worth. And what will happen is many of the students will carry them in their binders or backpacks or in their pockets, and they'll actually do it right in class. They'll do it in the lunchroom. They do it in the, they ask to go to the bathroom and it's done there. So this addiction is real. This is something that these kids are really struggling with. So we do have a text number for parents that can be used to access resources, and here it is. You can text HEART to 88709 to access a program called Becoming an X, as being an ex-cigarette user. So the number is on your screen, and thank you so much for having me.
No, thank you, and thank each of you on the panel. I'm going to take a few moments and read some of the questions to ask you from our audience members. But while I catch up on those questions, Margo, I want to ask you, that last slide, when I saw it, I was like, oh my gosh, they make the products look so colorful and enticing. And I would imagine that that is one thing that you guys are battling, that appeal. Tell me a little bit about that work, if you can.
Yeah, as far as the appeal, I think that's one of our biggest battles. Juul is constantly, like Dr. Hook said, you walk into a gas station and it's there. It is in front of your face. You cannot miss it. And as far as the flavors go, they are marketing it to our youth. Our youth are being attacked and led to believe this is great. This is a good product. They're not going to get sick. It's not smoking, it's vaping. It's totally different. So some of the assemblies that I've done, it's insane because they've actually talked about, or I've asked the kids about it, and they say that they think it's a vaporizer. They don't think that it's more like essential oils that they're using. And they actually tell their parents, it's essential oils, Mom. So that is a real issue. But we have also so many youth market directors doing assemblies and focusing on these middle school students to kind of educate them more. We have Julie Newhouse, And we also have Amanda Peterson, who's right here in on the west side of the state in Grand Rapids, focusing on the Grand Rapids schools. So we're trying to do our best to get them the information to know that it is an addiction, and the administrators as well.
Thank you, Margot. Thank you for your work. Dr. Hooks, I want to ask you this question. This comes from Executive Director of American Heart Association here in West Michigan, Jean Lesarge Bono. How quickly can teens get addicted to vaping? How do you get them to stop? How do you get them that help that they need?
Yeah, that's a really good question. You know, addiction can happen with many things, vaping included. It really just takes one introduction to it to create a habit. And, you know, if we were to start by preventing would hopefully eliminate that habit, but we know it's impossible to do that with everybody. So if kids do vape and they do get addicted to it, I think, you know, utilizing the resources that American Heart has really provided. I think they are exceptional resources for teens and parents, even those that are adults that are vaping, to have as a resource. And again, as what has been echoed is, you know, when they are vaping, the approach that, you know, we have to make sure of, we're not taking a punitive action, because I don't think that's going to create a behavior change. Just with today's youth, I don't think that style or that enforcement works, but educating them on the severity of it, how important it is as a family member that they're doing it, and the concern for their health, I think is a better approach.
You know, when you were speaking earlier, what struck me is the short amount of time between the introduction of these e-cigarettes into our world and these problems that we're discussing this afternoon. If you can answer this, the thing that struck me was there had to be approval. You know, there was research done. How is it that these things weren't caught before there was approval? What can you tell me about that research?
You know, I think so. You know, I don't know how it was marketed or how it was researched. If it was as a supplement or I don't know the FDA approval or the category which it was put in, but I think because we know that smoking has such a negative effect, when something new came on the market that could be used as a resource to reduce the consequences of tobacco use, I believe people were premature to, you know, support an alternatives, because I think before that we needed something else to get you out of that, you know, out of that hole that was created. That's as far as my knowledge goes about, you know, how it was created and, you know, rolled out onto the market.
No, that was great. And it also segues into another question from Jean. She wants to know, how does nicotine affect the brain, or what's actually happening inside those kids' brains with this particular addiction?
Yeah, I get this a lot because even people that smoke, they always tell me they smoke and it's a stress relief, or they smoke to calm them down. And nicotine is a neurotransmitter, and it's if anything, it's a excitatory. It's a very excitatory neurotransmitter. So when you're getting it, the nicotine causes, you know, an elevation with things. So it's an excitatory mechanism. But I think people now are creating neural pathways that not only is it excitatory, but it's satisfying the need. And those are what we have with the dopamine or the serotonin, the epinephrine. The adrenergic receptors within the brains now see it as a reward. And when you see it as a reward, meaning, you know, I did something good and I'm going to vape and reward myself from it, or I'm going to calm myself down. We start changing our behaviors by the vape itself. So the vape will now not only be the excitatory, the addictive part, the addiction comes as it affecting the neurotransmitters as a mechanism of, you know, it relaxes them or it satisfies their neuro needs. And it creates a behavior from it. That's how behaviors form.
Margot, are you seeing that as well with the kids in terms of them trying to kick this addiction? What are you seeing?
Yeah, we do. We see a lot of, we actually have a video out there that talks about depression and this, that students are leaning on this for their problems that they have. And it does calm them down. And yeah, they don't understand the problems that they're causing in general. So we see that a lot.
Thank you. Bridget, let me ask you this. Can you share an update with where the governor's emergency order against flavored and e-cigarettes stand right now?
Sure. There was a public hearing the end of October, and that was open to anyone who wanted to weigh in on the issue. There were a lot of parents who testified, the vaping industry testified, health organizations, and it was about 6.5, 7 hours of open testimony. So that hearing was an open hearing to hear comments on the proposed rules. These are proposed rules to put it into, as far as the ban on flavored vaping products, to put that into law. And this was from, this is a follow-up from the governor's emergency order last September that declared vaping a health emergency for teens, for youth. So they had the public hearing. There is a year time frame where they have a full calendar year to finalize the rules and then go through the process of implementing those. We're hearing actually that in early January, February, the first part of the year, the final draft will be out. So that's where we are right now.
Thank you. I just want to talk to the audience right now, remind you, we have a lot of knowledge here on this panel. So if you have any questions, we're running short on time. So this is a great opportunity to type those in. Then this next question can actually go to any of you. We're talking a lot about addiction, but sadly, tobacco is not the only type of addiction. Can any of you share what you may know about people swapping out marijuana with these devices?
I'll weigh in on that. A lot of those devices that they confiscate at school have THC in them. And the schools know this is happening, and it's an easy way to get it in there and hide it. And just like the asthma inhaler, that is mainly to put marijuana in, and nobody has a clue what's happening. Of course, we all can smell it, but they may not be.
Thank you. Well, this is certainly a very sobering topic, pun not intended at all. Now, Bridget, you and Margot have shared how the American Heart Association is all in the fight against e-cigarettes and vaping in our youth. Can you give a quick summary of your approach in this fight?
Sure. Well, the American Heart Association is taking a multi-pronged approach to address teen vaping. And as Margot has talked a lot today about how we are working in schools across the state. Second, we're working on policy initiatives at the local, state, and national levels. And finally, we announced the $20 million research project specifically around teens, vaping, and nicotine addiction to better identify long-term health effects as well.
Thank you. Margot, do you care to chime in on that as well?
Yeah, we're just active, like I said, we're actively working within the schools. We will continue doing across the state, we'll continue doing assemblies for middle school, high school students, continue getting those resources into the hands of the administrator and giving the information that it shouldn't necessarily result in suspension. I should maybe work more towards education.
A question that I had,
Yes.
Margot, if I could ask a question. With education, what are the schools themselves doing to educate the students about the harms of not only smoking cigarettes, but vaping?
Yeah, there's a lot of health classes that are being conducted, and a lot of them will turn to me to come in and teach a portion of the vaping. We have the American Heart Association deck that we share with them, so they like to use that. However, I'm not sure that all schools are able to give that information from what I've understood. I think that they're doing their best and they are educating as much as they can. However, I don't think all of our health people know the implications and know exactly what is occurring, just like what you presented. I don't know that they understand all of that. I've actually, and I have to say this, I've actually gone to a teacher who didn't think vaping was a bad thing. And it is kind of scary. It's very scary. So I really do think the education needs to be at home. And that's another thing we have to figure out how we can get that into the parents' hands. Did that answer it?
Yeah.
Okay.
And Angela, from your perspective too, working in media, how can this message be spread? How can we increase awareness from a media perspective as well?
Well, from a media perspective, I think frequency of stories, because this issue is so complex. I don't think that in all of the coverage I've seen, it really gets to the heart of the issue. It may cover very well one facet of it. And so I just think continuing to talk about events like this and with experts like you, and just slicing it up and really inundating public awareness about the dangers, the use, and again, the attractiveness of it, which I think when you're talking about addiction, it's really getting at that with that temptation, that very first temptation, and taking that off the table, removing that. So yeah, as a journalist, I look forward to talking to all of you in the future about this very important topic. Dr. Hooks, I do want to ask you one final question and then give you the opportunity to and share any additional knowledge you want to. When it comes to e-cigarette use, can people get cancer? I mean, you talked about that tobacco use, so I would imagine the answer is yes, but is the risk the same as with regular cigarettes?
Yeah, right now, as far as a cause and effect relationship, we haven't had enough information as far as scientific data, and we don't know definitively if that is occurring. We do know that the substances within the vape certainly are carcinogens, and they do predispose users to the development of cancer. But what we do know, though, is the use of the vape actually has been associated with lung diseases that will flare and will have exacerbations, and perhaps some are irreversible. So that aspect of it, we do know. I believe we're on to something, though. I believe we are on to something as we progress with it. Data and research is going to show that yes, perhaps this is similar, if not worse, of causing for example, lung cancer, if not more than cigarette use.
Hey, Angela. Angela, I wanted to make sure that everybody knew that they can reach out to all of us, our, youth market director in Michigan. Reach out to that person, because we do have those resources for the schools. We have the resources for the parents, everything they need to know. We have posters, all kinds of different things. So we have extensive research on this as well. So hopefully that helps.
Well, I can tell you as a parent, I am so thankful for all of you and all of the hard work that you're doing. Thank you for your time, again, your knowledge and your expertise. Many in the medical community thought that this generation and the ones coming up, our children and their children, would be tobacco free. And sadly, it is not looking that way. So again, thank you for all that you're doing. And we're going to stay encouraged on this topic because of people like you. Thank you all in the audience for being here. If your child needs help with addiction, as you heard Margot say, there is help out there. Contact your primary caregiver. Contact the American Heart Association. You can also find information on quitting by texting HEART to 88709 to get free advice, tips, and inspiration for quitting. Thank you again for everyone who's been a part of this wonderful program. If you have any additional questions, this would be the time to answer. We have approached our time limit. And again, you can contact these wonderful people. I'm sure they have email addresses somewhere on the internet that you can reach out to them. Again, Dr. Hooks, thank you for sharing such important information about the real risks of vaping. Thank you, Bridget. Thank you, Margot, for joining us. And a very, very special thank you to Ascension Borgess for sponsoring this community discussion about teens and vaping. The American Heart Association could not accomplish this great work without your generous support. Stay healthy, stay safe, everyone.